we start, or we can wait for like 2 minutes? I think Audil, you can share your screen first.
Yes.
Yep.
Recording in progress.
Okay, I think we can start. It's 9 o'clock right now.
Okay.
Yeah. First of all, let me introduce Professor Audil Rashid to our audience today briefly. Professor Audil Rashid is a permanent faculty as professor in the University of Gujrat in Pakistan. He leads the EcoHealth Research Division and initiates research across the fields of environmental education and health. He has received various Travel and Young Scientist Conference awards to present his work at international meetings world over. Audil has developed expertise in impact assessment and data analysis. He has designed several health risk assessment tools and led numerous projects as PI. Audil has always been passionate about sharing the education and experience over the years to help others feel empowered in making their own decisions to overcome structural barriers and achieve excellence. Okay, now, Audil, you can start right now.
Okay, thank you so much, Narlin, for this wonderful introduction. I'm so grateful to this journal, Eco-Environment and Health, which is very timely initiative taken by the professors in China and taken on board all other associate editors from many different countries. I think this is very good initiative to promote eco-health, urban health, and many related issues. Today I'm going to talk about urban pH exposure, evidence-based approaches to assess health risks. Actually, urban expansion is the challenge of 21st century. We are more urbanized world now, and compared to previous century, we have felt that people from suburban areas and rural areas are migrating towards urban regions. And day by day, the urban centers are being expanded, and many urban centers are so wide they have stability. One such issue is urban pollution. Wherever there is urban expansion, we know that we are bound
Recording in
population
progress.
are having certain health risks. So, urbanization in Pakistan is a sweeping statement. To some extent, we feel that urbanization in Pakistan is far more than any other country in the world. Pakistan is the fastest urbanization nation in South and Southeast Asia. Right now, we are estimated 222 million people, and out of which 37% is urbanized. This is a huge proportion. By 2025, we are expecting that this proportion of urban population will touch the 40%. And if this trend continues, the 4% annual growth rate of urban area will be a challenging one for Pakistan and the people of Pakistan. Right now, the concentration of economic opportunities in urban areas of Pakistan is shaping the country's economy, society, demography, politics, and more importantly, the public health and environment, which is the top priority of ecologists on one hand, but they are on the least priority for decision makers. That is why we feel that urban population living in the urban centers of Pakistan, they are more vulnerable to many issues. Why? Because urban vulnerability is a measure of eco-health status of a city, and which is intricately linked with the public health outcomes. And these two things are related to regional disease burdens. Unfortunately, wherever there is poverty, wherever there is inaccessibility of health facilities towards rural or towards poor population, the disease burden rises to manifold. And wherever there is absence of continuous monitoring system for health related issues, the vulnerability rises manifold. And there is another factor of socioeconomic indicators of the country, which indicates that in Pakistan, more than 20% of the population lives below the poverty line. So whatever the economic situation they have, they prioritize their money to spend on meeting their ends instead of spending money on their health issues. So this indicates that in Pakistan, most of the families who are suffering from many diseases, they compromise their health status because of their poor socioeconomic status, and they spend money on their basic necessity instead of buying medicines or instead of spending money on their routine hospital checkups. Then there is rural versus urban spam in the country. Over the period of last 2 decades, the country's rural economy is more shifted towards urban areas. Why? Because there are less earning opportunities in the rural areas, which is a global trend. And that is why people more and more think that they have better opportunities in the urban areas, and they tend to move to start new businesses, to search for their jobs, even for study towards the urban center. And that leads to develop a situation where urban pollution rises. And the growth rate and the imminent pollution problems are the outcomes of this rural urban migration. So today I'm going to talk about a city, Rawalpindi, which is close to the capital of the Pakistan, Islamabad. These two cities are called twin cities of the country. In 2016, World Health Organization regarded Rawalpindi is as the fifth most polluted city because of the presence of high amount of particulate matter in the air. And the alarming thing about this pollution status is that people living in the Rawalpindi, they are unaware of this fact that their city is the fifth most dirtiest city, and they are even unaware of this fact that they are breathing the air which is not safe for their health. This is a glimpse of urban population in Pakistan. On my left side, you see that there is a trend from 1901 to 2030. Urban population from 1.5 billion in 1901 in Pakistan gradually increased to 6 million. And by 1970, this figure rose up to 17 million. And in 1988, that climbed to 43 million. Last census indicated that in 2012, the urban population is 74.3 million, which is a huge proportion, which is beyond the scope of our policymakers and urban planners to cater the actual needs of the urban population in Pakistan. And if this trend continues, what will happen? In 2030, we will have 100%, 100 million people living in urban areas of the of Pakistan. Right now, we are 220 million. And out of this, if 100 million people live in urban areas, we can imagine what will be the situation. How this huge flux of population towards urban area can disturb the urban environment, the eco-health, the fragile ecosystems associated with the urban and suburban areas, all will gonna have severe consequences. On my left side, there are the five major cities of Pakistan: Karachi, Lahore, Quetta, Rawalpindi, Islamabad, and Peshawar. And all these cities have air quality problems. Recently, in 2021, Karachi was considered one of the third dirtiest or most polluted city of the country. Similarly, in Lahore, last June, the air quality index roses up to 300, and city was considered unsafe for the residents. But it is not possible for the government or for any country to move such a huge population away from urban centers if the air quality continues to degrade. And this is the major challenge. Urban vehicles are the key sites or the key point sources from where emissions are continuously contributing in the atmosphere, which discharge polycyclic aromatic hydrocarbons in environment. And it seems that they are the major contributing factors and enhancing the risk of chemical exposure. Chemical exposure, biomonitoring, and associated health risks in Pakistan for urban population is extremely neglected area in Pakistan. We have published a paper in 2012, our research group, EcoHealth Research Group, and which we have tried to present a data about Pakistan that chemical exposure in the general urban population and especially in the occupational settings poses high degree of health risks. And this is one of the most neglected area of research in Pakistan. That is why my research group is trying to bring forward the basic data, the health risks, and the nature of the chemical exposure which persist in the urban environment for general population so that the decision makers can develop a proper, effective intervention strategy to prevent these exposures. This is the location of Rawalpindi, and you can see that Rawalpindi and Islamabad are both closely situated. Islamabad is the capital city of Pakistan. Rawalpindi is next to Islamabad. And vehicle registration per day in both these cities is 500 for Islamabad and 300 for Rawalpindi. So you can imagine if this amount of vehicles are registered every day, how much atmospheric pollution is going to be added to traffic. Rising number of auto mechanical workshops and petrol filling stations are automatically increasing with this to cope the need of this high number of vehicle registration, and this led to urban traffic, urban pollution in both the areas. This is the background situation of Rawalpindi and Islamabad. These are the three sites in Rawalpindi: the Faizabad, the center one, this one is the Amari Road, and the southern areas from where we have collected the data. And I'm going to present the data of this study which we have conducted on these locations. You can see here why urban PH exposure is inevitable in Rawalpindi. These are the number of vehicles you can see on the left side. They are standing in queue, waiting for their turn at petrol filling stations so that they can get petrol. And on the right side, you see that motorcycles, they are crowded on petrol filling station. And most of the time, their motorcycles and their vehicles, their engine starts. They never turn off their engines. And what happens? These are the specific sites, and there are many such sites where there is continuous emission of there is continuous emission of traffic pollution, the contaminants which are released through the burning of fossil fuel, and they result in those hot spots in the urban areas where the polycyclic aromatic hydrocarbon concentration rises many times. And this is the case of those areas where the urban population is more exposed to polycyclic aromatic hydrocarbons. The background exposure in Lahore, Rawalpindi, and Quetta is very high. The total suspended particulate problem and PM10. These data shows that in major cities of the Pakistan, the suspended particulate matter and PM10, their concentrations remain very high throughout the year. And we know that particulate matter are those sites where organic pollutants they reside, and with the inhalation, these are being entered in the human body. That is why epidemiological studies on pollution indicate that mortality and morbidity related to PM in ambient air is particularly very high. In Pakistan, the fine particulate matter is also an important health issue because with the aerodynamic diameter of less than 10 micrometer, they can readily penetrate into the lungs and are therefore more likely to increase the incidence of respiratory diseases and many cardiovascular diseases. Exposure to fine particulate matter air pollution is an important determinant of public health, which may result in increased morbidity, mortality, and various issues related to cardiopulmonary diseases. PM10 is capable of causing inflammation of lungs because they are penetrable into the thoracic region of the respiratory system in human being, and both indoor and outdoor air pollution is growing, especially in developing countries like Pakistan. Now, this is the comparison of the exposed and unexposed sites for naphthalene and phenanthrene in urban dust samples collected. The upper graph is for naphthalene, and it shows that the samples which were collected from the roadsides and highways. Roadsides and highways are those sites where urban traffic, the location of petrol pumps, the congested, slow-moving vehicles, they release a huge amount of polycyclic aromatic hydrocarbons in the atmosphere, in the ambient air. And people living in close vicinity or standing for bus stations, or their work or their occupational sites or their educational sites are close to the roadsides and highways, they are more exposed as compared to the unexposed sites which we have considered 200 meters away from the highways. We have collected samples 9 a.m. in the morning, 12 noon, and 9 p.m. in the night. And all three times, the concentration of naphthalene was significantly high in the dust samples collected from these locations, and total mean of all location sites also indicate that there is a significant difference of naphthalene in these areas. Same trend was observed for phenanthrene. Phenanthrene concentration also was very high in the morning and in the noon and in the evening. However, the unexposed sites, which were relatively less exposed, they had a relatively higher concentration of naphthalene and phenanthrene at 12 noon. Probably because the amount of polycyclic aromatic hydrocarbons released in the atmosphere, they remain suspended in the air and they continuously being released. And because of less displacement of air in the hot weather season, their displacement is relatively less. That is why at 12 noon, their concentration was monitored high. The case of pyrene was also similar. The pyrene concentration at the 3 exposed sites was also very high, and all exposed sites showed that their concentration was significantly higher. So imagine those areas which are close to roadsides or highways or petrol filling stations. If the population is spending 4 to 5 hours or 6 hours on roadsides and highways, as compared to the population which resides away from the roadsides or highways, the vulnerability of these two groups of populations towards air pollution and health risk is many times high. Now, in this diagram, I have tried to identify the sources of polycyclic aromatic hydrocarbons. Here we have plotted a graph for the low molecular weight pH versus medium molecular weight PAH. And the ratio of naphthalene over naphthalene plus phenanthrene lies above 4.4, which indicates that most of the PAH, most of the low molecular weight pH are pyrogenic in origin. This means that they are released primarily because of the burning of fossil fuel. However, if we see the medium molecular weight polycyclic aromatic hydrocarbons, their ratio exists between 0.1 and 0.2. So those samples in which the ratio of medium molecular weight polycyclic aromatic hydrocarbon exists between 0.1 and 0.2, this indicates that probably they are petrogenic in origin. This means that apart from burning of fossil fuel and vehicular emission, there are many other sources which also contribute in urban PAH contamination, and that include the mechanical, automechanical workshops, automobile workshops, the those mechanic shops which operate engines of vehicles, and they change the engine oils, and they use some other materials which are related to petroleum hydrocarbons, but they are not related to burning. But as I have shown you that there are 300 to 500 vehicle registration per day in Rawalpindi and Islamabad. So you can imagine that how much automobile workshops are needed to cater the needs of these high number of vehicles. That is why there are many other sources identified in the urban area of Rawalpindi, which are also important in contributing the polycyclic aromatic hydrocarbons in the environment. Now, this is the data about the predictors of health effects which are associated with the urban PAH exposure. What we have done, we collected the response of population, and compared with the population which is residing away from main highways with respect to different health related parameters. So you can see here the shortness of breath was perceived 13.8 times high with respect to the population which is living away from the main highways. So if this exposure continues, then more and more people gonna have shortness of breath problems, and their risks to become confronted with this issue is 13.8 times high as compared to the population which resides when 200 to 250 meters away from the main highways. Same is the case for the eye redness. This is the problem which we have witnessed in huge number of population, or those students whose universities or colleges are close to the main highways. They also reported redness of their eyes, and their risk of eye redness is 3.16 times high as compared to the population which lives away from the main highways. Respiratory infection is also monitored as main health outcome. This is the self-reported respiratory infections issues by the population, and their risk of developing this issue is 3.15 times high as compared to the population living away from the main highways. And a very important factor, very important variable is the location of occupation. Here I'm talking about the petrol filling workers. I'm talking about the the mechanical workshop operators, those persons who are who change the engine oil, and their location, their workshops, and their petrol filling stations. If they are located close to highways, then their exposure and their health risk is 5.69 times high as compared to those occupations which are away from the main highways, which are away from the main roads, which are away from those locations where high traffic density is not the case. Here, I have tried to, this is the result of the principal component analysis for the self-reported health symptoms. Two types of main health disorders were recorded. The observations were recorded under physical disorders. Under this category, skin lesions, eye redness, dryness of tongue, appetite loss, and bronchitis, these were included. And neurasthenic symptoms were included for body aches, fatigue, fainting, twitching, sleeplessness, irritability, and depression. So the data was collected on 5 Likert scale, that to what extent they feel these health issues. So upon analyzing the data through principal component analysis, we have clearly identified 2 axes. The axis 1 explains the 31.5% variation of the total data set, which indicates that much of the variability of the data set regarding physical disorders and neurasthenic symptoms are explained at the first axis. Here we see that the physical disorder symptoms like PD1, PD3, PD5, appetite loss, eye redness, skin lesions, they are more observed for population who are exposed to urban PAH, especially they are living close to the highways. However, the neurasthenic symptoms are excluded in a separate group, which indicates that this is the group which is non-occupational, mainly urban population like students, like office workers, like who travel on bus and they spend time on roads through through travel. And in this group of population, the body aches, sleeplessness, irritability, and to some extent, depression was also observed. So this indicates that urban population who are exposed for more than 6 hours or more than 8 hours to those spots where the ambient air contains high amount of naphthalene or pyrene or phenanthrene, they develop these symptoms. Now, if these trends continue, what is going to be done for exposure prevention, especially for the control? We know that traffic is meant to release emissions, and adoption of emission standards and ban of import of used vehicles seems to be the only solution. Unfortunately, in Pakistan, because of the poverty, many families, many people, they have only one vehicle and they rarely been able to buy a brand new vehicle. That is why they are forced to buy a used vehicle. And when they use used vehicle, the amount of emission compared to the new vehicle for different for polycyclic aromatic hydrocarbons and other traffic fuel, their amount is very high. And this is the case for Lahore and Rawalpindi. And on my left side, there is an image of Rawalpindi area in which we have seen the fog. This is the condition when huge amount of traffic emission coupled with dust occupies a space in the ambient air, and satellite images has confirmed that there is a dense fog. In this condition, if people continues to breathe, especially children and elderly, their respiratory tract infections, asthma, and other related issues will rise manifold. Urbanization is the biggest driver. I have already mentioned that the urbanization trend need to be stopped here, and effective planning and relevant legislation is required so that this trend of urbanization can be curtailed. Deforestation and establishment of green belts in Rawalpindi urban areas is the need of the hour. At present, many green belts, they are being converted into commercial areas. And imagine when the trees are cut down, the avenues having trees on both sides, they have been deforested. Then the carbon dioxide and other air contaminants which are released in the air, they remain suspended for longer time as compared to the areas or cities which have enormous green areas. So this is one of the issues which we need to be taken seriously. Weather-related preparedness is also needed, especially during winter when particulate matter exposure is relatively high. So the next future, what is the most effective strategy for Rawalpindi and similar urban areas is to make a devoted effort to document the yearly facts and figures about the health outcomes. And I'm stressing here for the people of Rawalpindi because the population and hospital records indicates that during high atmospheric pollution days or on those days or in those months where air quality index rises many times high, the emergency hospital admission rate also rises. But unfortunately, there is no devoted effort to document those figures to raise the awareness among urban population. Awareness is the one important step, especially for public, and they can do this by wearing masks, especially in those areas when the particulate matter exposure is very high. And I would like to emphasize here the developing countries because I have spent time in Beijing as well, and there are many apps. When I was in China, and many students who are in China, they often discuss this thing that there are apps available, there are handy information available to the general public, and they know what is the PM status, what is the air quality index right now, so that they can adopt rational steps. For instance, if the particulate matter concentration is very high for a particular day, or we expect that in the next week or in a couple of weeks, this condition will persist. Then the use of masks, the periodic washing of nose and hands, and use of water for washing their faces is the effective remedial steps. But unfortunately, there is no awareness in Pakistan regarding this because the population is unaware the quality of air they are breathing. And that is what we have discovered, that the continuous monitoring system for urban population, for urban air quality is needed in the form of some apps or in the form of real-time data to be displayed on national television or whatever the media outlet available for the general population to access. And then we need to educate communities about the environmental hazards associated with urban population. In Pakistan, there is huge number of young people who daily commute from home to their schools or colleges, and they rely on vehicles, buses, which travel on the roads containing high amount of polycyclic aromatic hydrocarbons. Especially I have presented you the data about the pyrene, which is an important carcinogen. So the young people, if they continue to breathe the air containing high amount of pyrene, so expect what we expect that how much damage it will cause for to their health, because this is a carcinogenic PAH. So we need to educate our communities in this perspective. And also, I have repeatedly pointed out that we need to establish a continuous monitoring system for air quality and more in-depth analysis for hospital records of Rawalpindi city for the identification of determinants of many health issues, especially respiratory illnesses. Thank you. That's about my work. And I would like to take any question if you have.
Thank you. Thank you so much. Any questions from our audience? If you have question, you can raise your hand, and our host, I think, can unmute your mic, so you can just speak, or maybe you can type your questions in the chat window. Okay, let me ask a question, okay? Audil,
Okay.
yeah, I saw the map of Pakistan. So the Rawalpindi, the city, is in the north of the country. So have you investigated the impact of air pollution from the south of the country?
Unfortunately, no. In the south, there is a mega city in Pakistan, which you will be familiar, Karachi. The population of Karachi is beyond many countries in the European countries. So, but unfortunately, I didn't have the chance to visit there because of the limitations of the studies and the funding to collect the data or to collect air samples from there. But as I have mentioned earlier, that for Pakistan, the basic raw data, the reference data is still unavailable. And the government agencies like environmental protection agencies, EPA or local EPA, they have the air quality data, but this is mainly for the particulate matter, the inorganic component. Here, as an EcoHealth researcher, I'm more concerned about the organic contaminants like PAH and sometimes the heavy metals. So this requires sound scientific study. So when I realized that where I reside in Rawalpindi or Islamabad, this is the area which is in my access. So over the period of years, my group and I have tried to collect the information, and we have published several papers. But you are right, we need to compare this data from the south, because Pakistan is spread over longitudinally from north to south. But right now, I don't have any such comparison.
Yeah, maybe in different seasons, because the wind's direction may be different. I'm not sure, but that's like a thought.
Yes, northern areas have coastal areas, and obviously the wind pattern, the air circulation, the humidity, the temperature variation, that is certainly different from this area.
Yep. I see a person raise the hand.
Yes.
Yeah. Please talk, please.
Can you hear me?
Yep.
Okay. In your study, when you say roadside worker, so did that include the policeman or policewoman? Because it seems that actually is a very interesting kind of object and kind of to study.
You are talking about the roadside workers?
Yeah. What I'm saying is that in your study you have roadside workers, right? So
Yes.
did those kind of objects include a policeman or policewoman?
Yes.
Because
Yes.
usually they're actually standing on the roadside, right?
Yes. Yes, in fact, this need to be categorized. That is why I have tried to point out or highlight this thing. That when you are standing on a main road as a reference point, on both sides, when you move away from, say, like 50 meters in one step and 50 meters in another step and 50 meters in another step. So when you are moving away from the main road or main highway in any urban area, the level of exposure will gradually decreases. So if the population from one spot to another spot is different in terms of vulnerability, we need to tap, we need to monitor, and we need to present this level of vulnerability. And especially related to occupational perspective. On main roads, who are those people, who are those urban groups who are continuously exposed? They are policemen, they are the traffic wardens, they are the petrol pump workers whose petrol stations are related to, or situated on the main highways, and the population who are totally dependent upon the public transport. They spend more time on the main highways. So that was the idea to investigate whether people that spend more time on the road, whether they are occupational or non-occupational, they breathe for more time in the air which is close to the main highway or main road. So we expect, that was our hypothesis, that their PAH body burden or their health risk or their self-reported health issues will be relatively higher as compared to those people who are still the urban population, but they are slightly away. And our data shows that this is the case. So we need to further investigate this thing with respect to their genetic vulnerability, with respect to their diet, with respect to their other smoking status, or with respect to their passive exposure to things which are confounding factors for their PAH exposure. So, but you are right. That was the idea, and that was the basic concept to select this population.
Thank you.
I hope I have answered your question.
Yeah, thank you.
Any questions?
Hi, Audil. May I ask a question? Thank you for your nice talk. So you mentioned a lot of health risks and systems. Are they caused by the PAH or the whole air pollution? How about the risk of a pH and the other pollutants in air, like the TSP or PM10? Do we have any way to quantify them? Thank you.
My interest was towards pH more, because in 2000, why I'm telling you, I can tell you the reason why I more rely on pH, because in 2013 I had the chance to do my postdoctoral study at Peking University, Beijing, and there I have devised a research plan with my mentor, Professor Shu Tao there, and our focus was on PAH. So there may probably be other air contaminants which are responsible for causing health issues. But I have published a lot of research papers on pH, and we came to know, or this is our supposition, that two types of exposure with respect to pH prevails dominantly. One is the skin, and the other one is inhalation. The health risk which I have just mentioned in my presentation with respect to eye irritation or eye redness, this is the kind of exposure which is related to the skin. And in summer season, our major population, their most part of their skin is exposed to the air, and with dust and with perspiration, sweating, a huge amount of dust is settled down on the human skin as well, close to the eyes and on close to the nose where they breathe. So, and the color of those dust particles, which we, and the deep analysis of those dust particles indicate that the dominant contaminant in the dust of urban areas, especially in the Rawalpindi and Islamabad, is polycyclic aromatic hydrocarbon. So our first idea was that these health risks are because of the pH exposure, because of the presence of high amount of pH in the urban environment. But obviously, we cannot neglect other total soluble suspended air particulates and the inorganic contaminants like NOx and SOx, which might cause the urban pH exposure. But my line of interest was related to pH, and as far as we have gathered the data of the over many years, and we have now conclusive evidence, or we are more confident to state that many of the health risks related to skin exposure and breathing in urban environment is because of the pH exposure.
Okay, thank you.
Thank you. So do we have questions from live platform in Bilibili? Any questions from Zoom? Okay. So if not, I think that's the end of our talk today. So let's thank Professor Audil Rashid again. Thank you so much, Audil. Thank you.
Welcome.
I hope we can meet in person soon after the pandemic.
I hope so.
Okay. Thank you. Have a great evening. Thank you.
Thank you so much. Have a nice time. Thank you.
Have a good night, everybody. Bye.
Bye.
Recording stopped.